To define the purpose of a community health center, we must reflect back at the origins. The community health centers in this country were originally called neighborhood health centers. Today, because of the unique process by which health centers are reimbursed, we are also referred to as federally qualified health centers. The first health centers were established as a demonstration project under the administration of then President Lyndon Johnson's War on Poverty. With this combination of local resources and federal funds, the community health center movement began as a primary care model for communities with unequal access to health care for the poor and underserved. There are as many as 35 individual community health center organizations in Georgia, with more than 330 service delivery sites. As far as what services are provided, we often say in the health center movement, to see one health center is to see one health center. Each is unique in its own way, reflective of the communities it serves. Over the years, Valley Healthcare System developed its services as the needs evolved. A small number of community leaders from South Columbus met with the district health department and local hospitals, voicing their concerns about healthcare access and availability for residents in Columbus's South neighborhoods. An administrative resident at the Columbus Regional Hospital was familiar with the Community Health Center program and suggested that the group formalize and apply for funding to establish a health center in South Columbus. The new organization became incorporated in May 1992. After 2 attempts at submitting applications to receive federal funding to establish the health center, the Board of Directors of the Community Health Center of South Columbus was awarded the first grant in October 1993. The consultant working with the board recommended they contact me.
We started first with our Board of Directors and our new CEO. At that time it was Sarah Lane back in '92. And their goal was to build a facility that will help all members in the South Columbus area because there was not a medical facility in this area. So that was their goal, was to build a facility and establish medical care for our patients here all in South Columbus. And that started back in 1992, and then we actually opened doors in 1994.
I came on board in February 1994, and by August 1994, the clinic facility was opened and services began.
We started at first in the projects in Baker Village, which is a low-income projects. And from there, we started seeing more patient care, so we ended up getting a trailer, a double-wide trailer on North Lunkin Road. And after we had that trailer, we started growing even more to where we moved into a building on Delaney Avenue. And at that building, that's when we started seeing patients for dental and behavioral health, because we knew that there was a need for vision, for dental care. And so once we did that, we also got a building in Fortson and Tarleton.
And then we built our new facility, which is where we're at now, 1600 Fort Benning Road. And I believe we opened our doors for that facility in 2012. That was Ms. Lang's goal, to have the one-stop shop with everything under it so that our patients could come to us.
But not only do patients benefit from a health center, the community benefits economically. For example, in 2022, Valley Healthcare contributed $18.2 million in total economic activity generated in our communities. It added 73 employees and 53 additional jobs in our communities, brought over $2 in economic activity for every dollar spent. Patient care created an estimated $835,000 in savings to emergency departments and hospitals and reduced medical costs for uninsured patients by more than $2 million.
By being an employee also, you can see the dentist, you can get your meds here, you can be seen for medical. Maybe about 4 or 5 years ago, I went to the emergency room and they was like, you pre-diabetic. So me coming to the Valley, knowing that I have a doctor here, they treated me now that my A1C number is down, my blood pressure is under control. So being the fact that I am a patient here has really got my medical condition better.
Our motto, I would think, is we are here for you. We have all different types of services that we're able to offer you. My department is outreach and ACA navigator. So what I do is I make sure that our patients stay enrolled in Medicaid and food stamps. And also if they're employed and they don't have health insurance, I find a way to get them through the Affordable Cares Act. I'm a navigator with the Affordable Cares Act, so I find a way to get them health insurance through them.
I really love my job and working around people. We have a team effort around here. When we're short on something, there's always someone there to pick it up. And working around the people here is a great experience because we also deal with different cultures, people from different places. So being that we are diverse is a big plus to me.
And people say, wow, that's a long time, but I love my job and I love the people that I service. And now we're under new guidance. Ms. Lang's finally decided to retire, and we have Dr. Ashante Hiltz as our new CEO. So she's got a lot of different programs that she wants to get installed with Valley Health to help our patients. So I'm looking forward. It's time for me to retire, but I'm not ready yet. But I'm gonna keep on going as long as I can to help the clientele that we serve every day.